In this video, I would like to talk about the importance of reading the scenario thoroughly and properly. Many students or doctors, they miss the key things that are given in the scenario. Imagine if you're walking on the bridge, which you can see on the screen there. If that is a task, and let's say you forgot to ask about that, let's say that was the history taking task, you will fall. That means falling in exam is like failing. So imagine then if there is a task, the task at the bottom of the screen here, then there is one task here. Let's say this is history. Let's say this is examination. And let's say this is investigations. And let's say this is management. So there are 4 tasks. Your job is to move from one task, which is here, to here, then cross the bridge and go there. That's your final task. Even if you miss one thing here, let's say you miss this, you will fall down. You miss this, you will fall down. You miss this, you will fall down. You miss this task, you will fall down. So any task has got specific marks. For example, if this is the history taking task, this has got marks in the scenario. Usually each scenario will have a weightage. If this scenario says a 78-year-old man has come to you from a nursing home, he is confused, take history from the nurse and manage the case, which means this is a history weighted task, which means the majority of the time in this case is based on the history taking. So which means that you need to take detailed history in this scenario, which means you need to rule out everything about delirium. Most likely just reading the scenario that tells me that it's a case of delirium or dementia. So you need to take detailed history in that case. And in this particular case, that history taking task carries more marks or more weightage. Management is very little. You just order investigations and you manage the patient. But the history taking is where you come to a diagnosis. And many doctors, they just take brief history and they try to just stare at the examiner while they have 8 minutes. And in that 8 minutes, 6 minutes is pure history taking. So you need to understand the flow, the sequence, the thought process you need to develop in the exam. Just coming to a diagnosis of delirium will not help you pass the case. You need to come in a proper way. You need to rule out all the other differentials. And you need to be a safe doctor and you need to manage the patient. This is where a lot of doctors fail their OSCE or clinical exams, and medical students fail as well because they don't focus on the tasks. And even if you miss one task, that will have some marks there. So which means ultimately you might fail the scenario by missing a task. So it's very, very important. Don't fall into that trap there by missing the tasks. Make sure you have presence of mind. When you're reading the scenario, you need to have that presence of mind. You need to understand what the task is about and then plan everything. And you need to plan this outside the room when you're reading the scenario, not when you're talking to the patient or not when you're inside the room. When I'm reading a scenario, I have my own frameworks or strategies which I use. And when I go in, I have my routine framework. On top of that, I change a few things. I pepper these things which I brainstormed outside and I come to a diagnosis. That way, I finish all the tasks. I am organized. I save time and I will smash the case. So I want you guys to do the same. Develop all these frameworks and that will give you lots of confidence. You will save so much time. You will not miss a diagnosis. You will be a very successful clinician and a medical student where you can pass your OSCEs or clinical exams easily. I wish you all the best and I will see you inside.